Boys and girls, today's 420, April the 20th, 2024. My name is Shannon Boucher, otherwise known as Shannon B. Douglas, at Shannon B. Douglas on Twitter. Now, this is the weekly Canadian Gender Wars Report, and I'm sitting down this week to really dig into some media analysis about what's been going on in the world of gender. We are 10 days after CAS. I talked about that last week. We'll remember the world of gender identity ideology in the future in terms of before CAS and after CAS. So 10 days after CAS, we've got some interesting developments in Canada that I didn't get a chance to cover last week. I'm going to cover today. First thing, really breaking, at least in the media landscape in Canada, last week, the Toronto Star, on April the 12th, just 2 days after CAS, put up an editorial. Trans activists are over the top, demonizing and canceling and turfing trans exclusionary radical feminism. Anyone who questions the wisdom of aggressive, sometimes irreversible interventions. Political conservatives have exploited the unease around not just transitioning gender, but biological men using women's dressing rooms, washrooms, etc. So the Toronto Star has broken their silence on this. And, you know, it's an ideological piece still, but it is recognizing that the report is important. They haven't said anything remotely resembling criticism of radical trans activists. And here they are acknowledging, as Hilary Cass pointed out, the toxicity of the debate around this issue. A couple of days later, April the 15th, the CBC, we were all kind of waiting for CBC to weigh in on this. Actually, I learned about it on Twitter from the health reporter for the Globe and Mail, Andre Picard. And I have some choice words for Andre Picard because I have been poking at him for, I would say, more than a year about the gender identity issue in Canada, because he's been consistently putting up false information, defending the activist position on gender identity in his public comments on Twitter specifically, and the Globe and Mail, which should be, you know, it's Canada's slightly left of center newspaper. I've been a subscriber, unfortunately, to the Globe and Mail for 15 years, I guess, because they have a business reporting section that's applicable for me in my life. And so I've been a subscriber for a long time. G&M has not touched on this as of yet, 10 days after CAS. But nevertheless, Picard put up what CBC wrote regarding the CAS review on April the 15th. What Canadian doctors say about new UK review questioning puberty blockers for transgender youth. So what did these doctors say? There is actually a lot of evidence, not just in the form of randomized clinical trials, said Dr. Jake Donaldson, a family physician in Calgary who treats transgender patients, including prescribing puberty blockers and hormone therapy in some cases. A general practitioner, a GP in Calgary, not the only one. This one, he says that would be kind of like saying for a pregnant woman, since we lacked randomized clinical trials for the care of people in pregnancy, we're not going to provide care for you. It's completely unethical. So there has been initial propaganda put out trying to debunk the CAS review. And it is, it's disturbing the lengths to which activists will go to try and perpetuate their narratives. And we've learned that Dr. Hilary Cass now needs security. She can't travel on public transportation anymore. She's become the target of vicious activists who disagree with her research. To remind you again, the systematic evidence review that Dr. Hilary Cass oversaw in the UK was a 4-year project. Systematic evidentiary reviews are the highest standard of scientific analysis. A lot of people think that peer review is the standard. So if you get something peer reviewed, like that's scientific now. And actually what peer review does, as I learned from James Cantor when he was testifying on behalf of Amy Ham last year, that peer review is actually the first step in discussing findings. It is it's a group of peers who say, okay, well, the work that you've done is worthy of discussion discussing in the scientific sphere. And it's a point where the debate should begin, not where the point should end. So some people who know little about science saying, well, the Cass review isn't peer reviewed. In fact, what the Cass review does, or what it did, and what any systematic review does, is to analyze all of the available studies that are published, evaluate the quality, the soundness of the research, the level of the research that has been done, the type of research that have been done, and then to be able to examine from the eagle's eye view where the strengths and weaknesses are in the total domain of knowledge related to this particular topic or any other. And Cass finds the evidence and science so far wanting to be subtle, finds it wanting. There really is no evidence that things like puberty blockers and cross-sex hormones have a positive impact on kids with gender dysphoria. And what evidence there is weak, small sample sizes, short time frames, and little follow-up. Some of the studies are misrepresented or conveniently omit certain statistics. There was a British medical journal, it was New England Journal of Medicine. Around the same time that the British Medical Journal put up a piece about puberty blockers, and this peer-reviewed piece in the New England Journal of Medicine followed, I think it was 200. It might have been 300 teens, boys and girls, who had transgender ideation who'd been given cross-sex hormones. And they gave them surveys before and afterwards, or through this period of taking cross-sex hormones. And they found that the self-reports, they call that qualitative evidence. So, information gathered from interviews and collated. It is a type of scientific research, but it's near the bottom of the type of quality research that exists. And the doctors in Alberta, quoted by the CBC, are saying, well, there was no double-blind studies. And they make some observations about this that Hilary Cass said, since there was no double-blind studies. It's really diversionary and propagandistic. It's an unethical way by unqualified people. A family physician, I know family physicians, you're smart people, you put in a lot of work, but to put yourself into a domain where you're criticizing a project like the Cass report, and not just Dr. Hilary Cass, who was the head pediatrician for all of the United Kingdom, a population 80 million people, is kind of weak. So this qualitative survey, New England Journal of Medicine, 200 participants, you had to read down to the end of the survey. The survey claimed you give kids cross-sex hormones and they're happier. They'll tell you. But what they didn't tell you was that there were 2 suicides, successful suicides, in that cohort group. And when I ran the math, I looked at the suicide rates for teenagers in the United States across a number of years, both male and female. And out of the population of 100,000, what was the risk? And when I got out my pencil and my calculator, I determined that the suicide rate within the New England Journal of Medicine study, this is how bad these studies are, the actual rate of suicide was 75 times higher in the study participants than in the general population for teenagers in the United States. 75 times higher. Now, these are the people publishing these claims that these cross-sex hormones are better. They help in the mental health of teenagers. And they actually save lives. They stop people from committing suicide. So the evidence is very, very weak. And so far, the CBC hasn't made a move on acknowledging this. They put up an article on the 18th, just a couple of days ago, Gender identity policy lawsuits contend with missing documents and scheduling concerns. They're talking about the litigation against Premier Higgs in New Brunswick over the gender identity policy changes he's making in schools. I don't know. I know a couple of the interveners who are working in this case. I'm hoping that they're going to be able to present the findings of Dr. Hilary Cass on this issue to support the argument that we don't want these kinds of things happening in secret at schools, that the data, the research, and the cult-like adherence to the beliefs of gender identity ideology in Canada, which are deeply entrenched, are actually harmful to kids, and that Blaine Higgs is speaking up to protect children and families. Macdonald-Laurier Institute, one of Canada's leading think tanks. They're nonpartisan, based here in Ottawa. Time for an intervention, an urgent call to end gender-affirming treatments for children. J. Edward Less for Inside Policy, the Macdonald-Laurier Institute. If nothing else, the scathing final report of the Cass Review released this week, but commissioned 4 years ago, is a reminder that doctors historically are guilty of many sins. Now, I understand from Mia Ashton and Maria Hughes, who's a friend, that she's working on an article for MLI at the moment, so we're looking forward to a publication of that soon. J. Edward Less goes into some of the similar, big mistakes and atrocities that have plagued the medical profession. We like to think of it as a credible industry, and they're of course good people who are doctors and healthcare workers, but sometimes they get off track. So a repugnant New Zealand cervical cancer study in the 60s and 70s left women untreated for years so researchers could learn how cervical cancer progressed. Tuskegee syphilis study he talked about. Maria Hughes has been covering these things, the lobotomy scandals. There was a pattern in the late 1800s and 1900s of removing women's reproductive organs to treat hysteria, to basically perform hysterectomies on women. That's where the word, the excising of hysteria via hysterectomy. So Macdonald-Laurier is covering this. They've covered this issue before. And I've talked with people close to the executive at the Institute about this issue. They've had to walk a careful line over the last couple of years because they're donor funded. This was such a politically charged issue that they were worried that some donors would withhold support for the MLI and the important work that they're doing. So they couldn't cover it as much as they actually wanted to. National Post. April 19th, yesterday, how social contagion could be driving some youth to identify as transgender. A couple of big things here. One is that the writer, Sharon Kirky, who's written about this issue before, mentions CHEO, Children's Hospital of Eastern Ontario. But they mention that this is suspected social contagion. So to my knowledge, this is the first of a Canadian major media talking about the social contagion and what that means. And this has all the activists in the in tantrums and freaking out. A transgender identified man online yesterday said, well, I'm not a social contagion. And a lot of these people don't know, don't understand what social contagion is. So we acquire culture as children and as teens through the people around us. And we are wired to acquire culture. We're wired, we have certain onboard, tendencies, natures. We've got the nature-nurture debate here. We have a certain nature. And children acquire language and culture. That's part of the onboarding. Let's call it we're programming or being programmed by the environment that we're in, and where the environment is populated or filled with certain ideas. And we could call them memes and beliefs, and certain institutions of authority are perpetuating those memes and creating that culture. Children acquire the culture, so it's not surprising that we've seen a radical increase in kids identifying as trans. This article about social contagion was republished in the Ottawa Citizen. So the National Post does cover this. It's a statistic that I calculated, and I actually projected this number a couple of years ago. There were a couple of data points from spokespeople for CHEO over the last few years. One of them was in 2014, between 8 and 12 children presented to the Children's Hospital of Eastern Ontario with some gender incongruence. And in 2021, it was estimated to be between 200 and 250. Now, when I compared data from Trans Youth Can, which is a pro-trans organization, and the data from CHEO, and looked at comparable graphs of increases in presentation to gender clinics and the exploding number of actual gender clinics that we're seeing in the world. By the way, there's that New Brunswick new gender clinic that was celebrated this past week, the Nova Scotia. So they're still growing. I projected out based on just simple exponential growth models that growing at 80% per year, that in 2023, our Children's Hospital, Eastern Ontario, we call it CHEO here, would see 500 referrals of kids with gender incongruence. And in fact, I told the Ottawa Citizen this several months ago. So in England, referrals for puberty blockers and cross-sex hormones have increased more than 100-fold over a decade. In Ottawa, the Gender Diversity Clinic at Children's Hospital Eastern Ontario once saw 1 to 2 patients a year. The clinic now cares for 400 to 500 children and teens over the course of a typical year. Exploding numbers. I wrote to the Ottawa Citizen. I'm going to maybe read a piece from that about the WPATH files. Most Canadian self-regulated medical and psychological associations defer to WPATH standards of care in its 8th iteration. Standards of care 8 eliminated all age limits for sex-changing children, including eunuch gender. It included eunuch gender, and approved extreme body modifications, sometimes referred to as nullification surgeries or nullos, which remove all visible traces of external genitalia, resulting in the Barbie and Ken doll appearance. Canadians are waking up to the real harms caused to children and families by the gender affirmation model. Up to now, these practices have been held as unquestionable in the public square because heavily funded activists have bullied opposition and systematically used institutional disciplinary mechanisms and lawfare to silence clinics. The spiral of silence, as Mia Hughes has previously written about, has prevented the public from understanding the enormous implications of gender activism in schools and clinics in Canada. Based on data reported previously that was provided by CHEO and modeled on patterns of exponential growth, a conservative estimate is that CHEO received 400 to 500 referrals to the gender clinic in 2023. I said this to the Ottawa Citizen at the beginning of March. And now they've picked it up. They've picked it up. I believe it's come down from on high because the editors at the Ottawa Citizen have refused to publish anything I've ever sent to them. They platform people like Neely Kaplan-Mirth, who bullies at anyone who questions it. So the Ottawa Citizen and their editorial group has been participating in this this project to silence criticism from concerned parents about gender identity ideology and how it's impacting in the education system and the healthcare system. Maybe this is time that we can plug into Maura Demings, MP from the UK.
Thank you, President. I would like to begin by congratulating my friends and fellow parliamentarians in the UK for all of their work in getting the CAS review up and going and finished. In the face of vicious, malicious abuse made only worse by the cowardice of all those around them who knew the truth and instead chose to protect themselves over children. To all the clinicians, teachers, lawyers, MPs, ordinary people, parents and brave detransitioners who have been raising the concerns for years about the unethical and unsafe practices of putting vulnerable children on irreversible and unevidenced medical pathways with the aim of achieving something that can never be achieved, which is to live as the opposite sex, because it is impossible to change sex. Like them, I warmly welcome the Cass Review and its findings and look forward to the inevitable end of one of the worst child safeguarding and medical scandals of our generation, not only in the UK, but all around the world.
Yeah.
15th of April, National Post, again, one of the leaders, the thought leaders on this, an early adopter in at least the media landscape in Canada, but late to the party as far as I'm concerned. Writer Tristan Hopper writes, first reading as child gender transition scandalized the UK Canada Devils down. No mainstream Canadian health body has even hinted that puberty blockers for children might be ill-advised. I mentioned Andre Picard from the Globe and Mail. The Globe and Mail still hasn't put up anything about this. And then we have, let's pull back to some international stuff. So a couple of days ago, Scotland has come down with a ruling on puberty blockers that they're no longer to be issued by their medical system for gender dysphoria. Yesterday, France, I believe the Senate is putting in force some policies in France forbidding puberty blockers. So we've seen, even since the Cass report, a couple of countries who have taken steps on this. Psychology Today has been almost as bad, almost as captured as Nature. Right? Nature was once a prestigious publication that brought science to a popular audience. The journal Nature has been totally captured, but Psychology Today, an American publication, publishes Noam Spencer, PhD. Does our approach to gender dysphoria need an overhaul? This was big news. Europe is I want to say over this, but there are most of the major media is covering this. We had a major coverage by the New York Times, an opinion piece, a big one this week. Washington Post also followed, and this is going so fast, in fact, that Pink News, a notorious rainbow activist organization that has participated in the bullying and the intimidation and the defamation of all critics of this, has published. Their headline is Cass Report urges extreme caution in prescribing puberty blockers to trans youth. Now, I'd rather not refer to kids as trans. Kids can sometimes have gender identity issues, but this is actually a reasoned publication from Pink News about this issue. So we're waiting for big changes in Canada in the media landscape to follow this, and when we're seeing sweeping changes from around the world. Now, I'm going to share for you a piece, some info from a piece that I'm working on. And we're beginning to collaborate with a number of other groups because institutions have to fall on this. It's not just media that has to change. It is institutions are deeply captured by these activists. In Canada, we have groups like EGAL. We've got Faye Johnstone's group. They're receiving millions and millions of dollars in the pro-LGBTQ, pro-trans efforts from the federal government. That money is getting to ideological researchers like the Wayne Martino and Keenan Omaragic piece that Melanie and I have been looking at. Melanie's doing incredible dive on this subject matter. But $500,000 going from the federal government to a research for provincial level education to create the trans affirming toolkit for Ontario teachers, to with an agenda of combating default biology and normal sexual attraction patterns in human beings, to combat those as as oppressive structures that lead to transphobia. I went to the institution the federal organization that provides those fundings, and obtained several significant spreadsheets of research projects around transgender ideology, um, and queering the environments, and to supposedly combat heteronormativity, and we can tally those in the tens of millions of dollars. So our institutions, diversity, equity, and inclusion advocates, uh, you know, place the transgender, the affirmation model under their umbrella. They fight and advocate for this. They call people names. They use institutional bullying and pressure and tactics to fight anyone who questions this. So uh, let me, this is a bit of a draft. And I just want to give you a sense. So I'm writing to the Director of Education for the Ottawa College and District School Board with the aim of, first of all, making him aware of the significance of this report and how important and credible it is, and what the problems are. And, in the UK and elsewhere, these tactics and the close relationship between activist organizations and medical facilities created poisoned environments where ideology and a climate of censorship and fear overruled science and fundamental medical ethics in the treatment of over 9,000 children. That's the severity of this scandal. And I'm having trouble keeping my list up to date, but I finished the letter with a summary for the Director of Education so that he can understand just how fast this is moving and what other countries are doing, and recognize that Canada is in an environment where we are not responding to this appropriately, where our Education Minister in Ontario, Stephen Lecce, and Doug Ford haven't taken a policy stand on this. They've made loose references to indoctrinating children and loose references to schools shouldn't keep secrets, but I've said they're not making any changes. So, my effort here is to put the Director of Education and some school board trustees on notice about this, because being that we are after Cass, where we now know better, it's established in the highest quality of scientific standards that these interventions and these policies harm children, that we have to take action. And it's not going to be an easy thing to do, because the DEI bureaucracies and the structures and the tentacles of these activist organizations that are funded to the tune of tens of millions of dollars a year, and we did this again this week in the federal budget to show that something like $800 million of federal money is being put towards diversity, equity, and inclusion efforts. And underneath that, although I'm not totally clear, is the $100 million that was allocated to the Rainbow Mafia over 5 years in 2022 in August. A big announcement about how virtuous our dear leader is. Okay, so here's a summary. Concerns can no longer be shouted down by social justice activists and abusive zealots. What follows is a summary of science-based interventions and policy changes by governments in Europe. Finland, July 2020. Finland abandons Dutch protocols of affirmation, puberty suppression, and cross-sex hormones, moves to treating dysphoria and body dysmorphia through psychotherapy. Sweden, May 2021. The Karolinska Gender Clinic ends the use of puberty blockers and cross-sex hormones for children and teens outside clinical trials, restricted trials, that is. February 2022, the Sweden National Board of Health follows Karolinska with national recommendations. Norway, 2023 March, health authorities' new guidance, puberty suppression and hormone treatments unsafe. Denmark, 2023, sharply reduces pediatric gender transition after red flags, including recognition that significant social influence on exploding numbers of children with cross-sex identification and concerns about detransition. So they're recognizing social contagion. In Italy, I didn't put this in the report, there are now criminal investigations into doctors who've been doing these gender transitions to kids in clinics. I think it was Portugal that warned about social contagion a couple of years ago. So back to the list: Denmark reducing pediatric gender transitions after red flags. United Kingdom, of course, we know, following the CAS review in April 2022. That's the interim report. The UK government ordered the world's largest pediatric gender clinic, the Tavistock, closed, condemned the use of puberty blockers, and restricted their use, as well as the use of cross-sex hormones for under 16s. 2024, the NHS bans puberty blockers in March under new clinical guidance, clearly in advance of the CAS report. 2024 April, the NHS recommends extreme caution for medical transition of 18 to 25-year-olds in the United Kingdom. National Health Service launches full systematic review or announces intent for adult gender medicine. So they're looking at the whole thing. Publication of the CAS report, April 10th. Days before the release of the CAS report, the UK government issues guidance to schools to stop teaching gender ideology. If children ask about gender, teachers can answer, but must disclose that these are controversial beliefs. Now, to the point about the school systems, there are resistant activist teachers who have already spoken out in the UK saying they're going to defy these recommendations. In France, March of 2022, French Medical Association urges great medical caution in treating children and adolescents, suggests social factors are driving the epidemic-like phenomena. A quote from them: mechanisms involving adolescents may include excessive engagement with social media, greater social acceptability, or influence by those in one's social circles. The epidemic-like phenomena manifests itself in the emergence of cases or even clusters of cases in adolescents in their immediate surroundings. Primary social problem is due in part to the questioning of an overly dichotomous view of gender identity by some people. On to Belgium. The director of the Belgian Center for Evidence-Based Medicine, Patrick, I'll call him Patrick V, has joined a growing list of experts who are criticizing the highly medicalized gender affirmation treatments. Germany, the official German Medical Association, they were due to release a report yesterday, April the 19th. They said some time ago the scientific evidence that the therapies are more beneficial than harmful is not as robust as has long been proclaimed. Scotland, I mentioned, health authorities suspend the prescription of puberty blockers, sex hormones under 18. France has added another layer where they are banning puberty blockers, and this is just in the last couple of days. We exist in an environment in Ontario, I went on to say, where activists pushing gender ideology still have a stranglehold on our institutions. Activist organizations and government-funded pedagogues are deeply influential on those institutions. But the affirmation-only policies and practices of automatically affirming gender identities, including those that don't exist in nature, is now considered unsound and even dangerous for children. So a lot of these institutions are going to have interventions. The self-regulatory bodies, there's conflict in Alberta, where if Alberta is passing laws, I'm reading this in some of the back channels, to curtail the use of puberty blockers, it's a no confidence in the self-regulatory bodies that govern medicine in Alberta. And the government can stick their hand in there, or if those organizations have demonstrated that they're incapable of ethically regulating their own conduct, then these institutions will have to be dismantled and perhaps rebuilt, or perhaps there is a government mandate for regulating the profession. We've seen that these self-regulatory bodies have become corrupt and captured by this ideology, these beliefs that are distortions of reality. The BC nurses and midwives, as we all know, have been persecuting Amy Ham for 3 years. Now we're a month and a half on from the oral arguments. We may see some decisions before school lets out for summer, but likely it will be several months before we hear a decision on that case. And of course, the Ontario College of Psychologists the persecution of Jordan B. Peterson over issues related to his comments about transgenderism and the risks of it, and his plain speech about the issues. Now, I really believe, is when the hard work is going to begin. We're going to have to rebuild credibility within our institutions. At the moment, we can't trust them. We can't trust the medical system because they've been controlled by activists. We can't trust the College of Psychologists. We can't trust the College of Nurses. If they can't differentiate between, if they can't tell what a woman is, and they're medical professionals, and they can't explore a psychological distress because it has to be automatic affirmation, we can't trust these institutions. Now, I believe that this correction, this healing that we're going to have to go through, is going to take some time. And it's not going to be easy. And it's going to require and give space now to people who have been speaking up about this issue to speak more plainly without the vitriol and the abuse and the attempts at cancellation and career destruction. Institutions are going to have to recognize just how toxic they've become to any kind of deviation from their orthodoxy. And the canary in the coal mine here of how toxic these institutions, like our public education system, our school boards, our universities, our medical establishment, and even our military, have become so toxified that we need to figure out a way to bring sense back. So the work begins. My name is Shannon Boucher. This has been the Weekly Canadian Gender War Report. I'll be back again next week, hopefully with bigger news about how we're waking up from gender madness here in the country. And I wish you a terrific week. If you've got stories that have come up for you and issues of concern, please feel free to reach out. My email is shannon@chasingquicksilver.com, where I'm happy to take story ideas or reports of ongoing gender madness. And I will leave that there.